Hello, everybody, and welcome back. A quick reminder that the presentation will be followed by a Q&A session. Now, to introduce our next presentation and moderator, we'd like to welcome back Dr. Cameron Stocdale.
Hello, everyone. It's my pleasure to introduce this second session of our conference. And we're looking at iCanWork research. You know, for some, the idea of returning back to work after cancer treatment or during cancer treatment is getting back to their new normal. However, this starts with planning and understanding your current abilities and how that relates to the demands of your job. One of the things I've learned working with the team of panelists that are going to be speaking to you is that you don't need to be 100% before you go back to work and you start this plan, but it does require a discussion with your employer, your healthcare team, and your support network. This panel highlights the evidence-based approach to this planning process so that an employee's return to work is a successful one. And I think that what we're going to talk about here really highlights the idea that workplace plans are not a one-size-fits-all, but that they are individual in nature. With that, I would like to turn it over to Tammy Yates as the moderator. A little bit of background on Tammy. Tammy is the Executive Director of Réalise, which hosts the Secretary of National Coordinating Committee on HIV and Aging, the National Community Advisory Group on Optimal Health and Wellbeing in HIV, as well as the National Episodic Disabilities Forum. Tammy didn't know I was going to do this, but a bit of a plug for her organization. Our staff took one of Tammy's workshops, the Episodic Disabilities Workshop, and our team here thought that was fantastic. So a bit of a plug for anybody who's listening to go to your website and find out more about that. So there you go, Tammy. I'll turn that over to you.
Thank you so much, Cam. What a pleasant surprise. I genuinely did not know you were going to make that plug for us. Thank you so much. That's the essence of teamwork and partnership. So I'm so thrilled to be here, and firstly would like to thank you, Cam, and your amazing WWI team for the invitation to moderate this important session. Firstly, I'd like to share that my pronouns are she and her, and I've been a settler on Turtle Island, which we now call Canada, for the past 9 years, having migrated from the twin island Republic of Trinidad and Tobago. Centering us all in this National Indigenous Disability Awareness Month, I'd like to respectfully acknowledge that the Réalise office sits in Toronto on the traditional territory of the Wendat, the Anishinaabe, Haudenosaunee, Métis, and the Mississaugas of the Credit First Nation. The topic covered by our panelists today has such a direct impact on me, as I'm sure as it has on many of you, since some of the closest people to me have walked this journey with cancer. On that note, I'd like to introduce you to our two esteemed panelists. And firstly, Maureen Parkison. Maureen has worked for over 25 years as the BC Cancer Agency Provincial Vocational Rehabilitation Counsellor. Previously, Maureen worked as a vocational rehabilitation counsellor for a public rehab hospital and a vocational rehab consultant for insurance and law firms, and as an instructor or facilitator of job search, career exploration programs for contracted services by Service Canada. It's also my honor and privilege to introduce you to Dr. Christine Maheu. Dr. Maheu is an associate professor at the Ingram School of Nursing at McGill University and an affiliate scientist at the McGill University Health Center Research Institute Cancer Program. Maureen and Christine, welcome. The floor is all yours.
Thank you very much. And thank you very much to Work Wellness Institute and the team to allow us to come and speak on behalf of Christine and I, for allow us to come and share with you iCanWork and the CancerWork website. Next slide. So today we're going to review the literature. Starting Christine will be reviewing, and we're going to show you the vocational rehab model for cancer survivors as a conceptual framework to sort of review the research. Then we're going to move into discussing the iCanWork, the 11-step step program in order to support return to work. And then Christine will move on to discuss the iCan research studies. And at the end, we have references for all the information that we sort of relayed to you. Next slide.
And to get us started, to begin, so the number of cancer survivors, what we're seeing is that it's steadily increasing. There's this changing landscape in the treatment of cancer that makes for an increase in survival rate among individuals who are newly diagnosed with cancer. In Canada, annually, we're seeing there's about 226,000 individuals who are receiving a cancer diagnosis, and 50% of these people are 65 years and younger. There's a future projection that's suggesting that in 2031, there will be 2.2 million Canadians who are going to be living with a cancer diagnosis, giving rise to this large population of cancer survivors. And cancer diagnosis in employed individuals is becoming more common, with half of the adult cancer survivors being younger than 65 years old. So why is it important to pay attention to individuals with cancer of working age? So cancer survivors often report a desire to re-engage in paid employment and indicate that returning to work fulfills the needs for financial independence, and a sense of productivity positively influences their quality of life as well. What is more, a return to work facilitates a return to normal life, a resumption of work identity, and reduction in social isolation. And from a societal perspective in Canada, given the aging population, more individuals are predicted to leave the workforce, which means maintaining, optimizing, and enhancing all the workers, including cancer survivors and individuals with disability, enhancing their participation in the workforce is of utmost importance. We are also seeing financial hardship from cancer and from job losses increasingly being documented among cancer survivors. There is an estimation from 2009 that indicated that new cancer in Canada generated a wage loss of $3.18 billion annually. And for those facing cancer, their annual income was 26.5% lower. So having cancer can result in functional impairment that can impact a person's work ability. And that is, cancer and its treatment can lead to suffering from short and long-term and late effect from cancer and its treatment that leaves individuals with an impaired health as a result of their disease. And this impairment, such as neuropathy or a decreased sensation in the upper extremities, such as the fingers, can lead to a decreased ability to work or even disability. In fact, there's a meta-analysis by DeBoer that indicated that cancer survivors are 1.4 times more likely to be unemployed compared to their healthy counterparts, and this because of poor health and disabilities resulting from cancer and work limitations. Among cancer survivors experiencing these late and long-term effects from their cancer and their treatment, there's a report that 31% on average will have a deterioration in their physical work ability, and 23% in their mental work ability. And for some individuals, their problem will persist for years after their primary treatment has ended, which affects then their ability to continue to work and their working conditions. The level of psychological distress induced by cancer is also shown to mediate that level of work-related stress, and though leaving individuals suffering already from cancer-related distress more at risk of work stress. And so to help understand these different factors that can impact the survivor's ability to work and return to work, it can be useful to sit through a vocational rehab model for cancer survivors that's published. You have the reference there, I think Parkison in May 2016. And this model describes 4 factors that influence the return to work, those being biopsychological factors, person-related factors, systems, and worksite factors. There's other reviews as well that have been published that illustrate that some of these factors, or all of these factors mentioned in this VR model, actually does impact cancer survivors' ability to return to work. And so if you look at the first factor, biopsychological, these encompass the type of disease, in this case, type of cancer, type of treatment that are known to influence the prognosis and the recovery from cancer and its treatment, such as receiving chemotherapy or not, and the stage of cancer. And with respect to the disease type, if we take breast cancer as an example, we see that on average, 35% with early stage breast cancer are absent for more than a year, with 47% with brain cancer reporting they cannot work. But 38% of head and neck cancer do return to work after treatment. But among this 38%, you see these are people that are suffering from less cancer-related distress than those who did not return. And then survivors who have chemotherapy are more likely to report impaired workability, more time off, reduction in work hours. And we see that chemotherapy is negatively associated with return to work. And that those who had chemotherapy or a combination of treatment were more likely to have lower executive function and being longer time off than those who didn't. So those with multimodal therapy and surgery often have delays in return to work, and the degree of treatment toxicity delays the job entry. But those who have surgery alone tend to return to work sooner. With respect to the prognosis, we see that those who are expected not to survive with 2 years after their diagnosis have higher rates of stopping work. Those with advanced stages were more likely to have prolonged time to return to work and more disabilities negatively influencing the return to work and resuming work. With respect to poor health status before the diagnosis, so having other chronic illnesses or disease is associated with reduced workability. Hence, what we see in the literature is that having pre-diagnostic physical and mental morbidity or comorbidities are risk factors to sick leave absence. And with respect to function and disability, so fatigue and exhaustion were reported as some of the most prevalent symptoms to impact the return to work of cancer survivors, especially breast cancer survivors as well. And among those still working, reporting difficulties with tiredness and concentration. And we also see that those who suffer from depression following cancer is also associated with higher overall work-specific cognitive challenges and delayed return to work. So cancer and its treatment can have a profound and lasting effect on psychological functioning and physical functioning that can result in poor workability. And we do have systematic reviews that show that 1 in 5 cancer survivors will experience some of these ongoing psychological problems that will affect their workability and the delay in return to work. So under person-related factors are the other factors. So many cancer survivors, they'll describe a change in the meaning, the priorities, the motivation, and the ambition to work after the cancer experience, which can affect on work even 5-10 years after. And then in one study, among 21% of women with breast cancer who were unemployed at 3 years post-diagnosis, 84% of them said they chose to stop working on their own initiative, with some survivors reporting preferring to prefer to stay at home with their families. And a change of priorities with work was reported particularly for those who were highly invested in the non-working life. While some cancer survivors talk about finding work that was meaningful, others wanted to transform from being a workaholic to having more balance in life. As well, the attitudes about work can influence the return to work. So some expressed that work was positive, part of their identity. Work was a place for accomplishment and self-worth, a measure of healing, and a way to return to normal, so providing a structure to one's life. Conversely, there's a subset of cancer patients who return to work report experiencing deterioration in their job satisfaction and career prospect, hence experiencing a form of job discrimination. And others feel that working and health, they're not synonymous. There's one study that showed that occupational stress and higher levels of commitment at work was associated with greater probability of early retirement. But of note, one area that's lacking right now is that cancer survivors' belief system is that cancer is caused by work stress, which is commonly being reported by patients attending Cancer and Work and the BC Cancer Return to Work workshops that Maureen holds. The expectation of recovery also is a strong predictor of return to work and work functioning, and perceived productivity increases the chances of working, while cancer survivors who perceive diminished capacity had more difficulty finding and remaining at work. And some of the socio-demographic factors, such as increase in age, has been associated with early retirement and younger age most likely to return to work, while lower education is associated with less likely to work following cancer and with lower employment rate. In gender, And men are less likely to take sick days off, but if they do, they take longer than women. And while women are twice as more likely to take 6 to 12 months compared to males, yet further analysis by sex and gender, by sex and age, I mean the time of the cancer diagnosis, does reveal higher risk of unemployment 10 years out among males compared to females, and among patients that are diagnosed at 40 years and older versus under 40 years. There's also higher education and exercise that's positively associated with a return to work period. And by race, we have found that job retention being lowest among Chinese women, then increasing among Korean, Latinos, Black, and white having the highest job retention. If we look at the third factor, system factors that can impact return to work, these include medical system, rehabilitation system, family, financial support, and legal support. So with respect to medical and rehabilitation influences, the lack of medical advice on how to prepare for return to work and advice on the appropriate time to get back to work has been found to be a barrier and a delay for returning to work. So cancer survivors report their work functioning is negatively influenced when physicians only give advice based on protocols or do not take their personal situation into account, such as the need to take time off work for medical appointments. And these adds pressure for cancer survivors to try to make up time for those loss of work hours. But in contrast, cancer survivors perceive that physicians can be more helpful if they show understanding, give tailored advice about gradual return to work without pressuring for work attendance. As well, there's one study with healthcare providers reported not being fully aware of those specific impact of treatment on work, so resulting in little guidance on what to expect following cancer and returning to work. And here we're talking about these late and long-term effects of cancer and its treatment and the impact on the person's work and workability. And specific to medical and rehabilitation support, the breadth approach leading to higher return to work rates among cancer survivors has been one that incorporates a multidisciplinary treatment approach with vocational counseling, physical activity, and psychoeducation. Also, having family support is a facilitator to return to work, but then having overprotective family members and those not supporting the decision to return to work has a negative impact on returning to work. In terms of financial support, having some financial strain, lack of financial reserves, and upcoming termination of sick leave benefits can result in having to return to work too early, but not coinciding necessarily with the person's readiness for return to work. And in terms of legal and advocacy support, we found that those who are in a unionized job tend to report more work absence than those who are not. And then in the US, with respect for filing for discrimination, there were more cases for cancer survivors who considered there was some discriminatory reason to them compared to those who filed for general disability population. In relation to the last factor, worksite related factors that influences return to work among cancer survivors include the type of job, manual versus a desk job, the physical and the psychological and the cognitive job demands, the work hours, whether the worksite provides for job accommodation, and the type of communication or the support or the lack of from the colleagues and employees. So those with stressful jobs are found to be less likely to go back to work. And with respect to job demands, there are lower rates of return to work post-cancer treatment for those in manual work, working part-time, working in a private business and high demanding jobs, while having work autonomy facilitate work's functioning. But barriers to work functioning includes ambiguous communication with the managers, the lack of support, and a change in the work environment. On the reverse, higher rate of return to work occurs for white-collar jobs where there is lower risk of early retirement than in blue-collar jobs or with self-employment. In a Canadian study, it was found that individuals with cancer who were self-employed were less likely to report work absence compared to salaried workers. And what about work accommodation? Well, having a flexible schedule and a gradual return to work are important factors for job retention and return to work among cancer survivors. Additional facilitators to working are having modification of work duties and work performance and an understanding of the work performance expectation, such as providing adaptive aids, work technologies, and perhaps even providing for retraining and support at the workplace, possibility for working part-time, having appropriate work accommodation. But we've also seen that women in low-income jobs, they're less likely to have accommodating employers. Other work accommodation that's helpful for return to work is having a workstation adaptation. This is also associated with remaining at work 5 years later after the cancer diagnosis. And support at the workplace, and particularly from the supervisors, and having a psychological well-balanced environment are more likely to foster a return to work and increases the possibility or the probability of working 5 to 10 years later, especially among those who feel supported at work. So while those who perceive they have weak support from their supervisors and occupational health personnel are more likely to change jobs after cancer, as well as for those who had pre-cancer strained relationship and inflexible workplace policies are less likely to return to work successfully. And now to illustrate the difficulties that can be associated with returning to work after cancer, we'll present a 5-minute video by Frederick describing the experience of returning to work. Frederick is not an actor, but a user of the iCanWork website. And so in terms of biopsychological factors, you'll see that Frederick is middle-aged, white, received a lymphoma cancer diagnosis, highly educated, had chemotherapy, and that following cancer, he experiencing cancer-related distress, anxiety, depression, and cognitive changes. Person-related factor, he's a mid-career, wondering if he sees life differently following his cancer, but does enjoy his work. Under system, return to work plans were not made part of his end of treatment plan, leaving him to navigate on his own all the system to assist with planning his return to work. In terms of worksite factors, he had the support of his employer and colleagues, and he felt supported at work. So here's the video.
My name is Frederick. I'm 54. I was diagnosed with a blood cancer about 4 or 5 years ago. Specifically, I have CLL, which is a chronic lymphocytic leukemia. I spent the first 2 years in anticipation of essentially the disease progressing. And after 2 years, it did progress very quickly. And I ended up, doing chemotherapy and immunotherapy. I had to take 7 months off, essentially. So I would say 5 for the treatment and a couple more months for the recuperation. I was looking forward to going back to work. I was exercising, I was taking care of myself physically. I was a little bit better. I wanted to feel useful again at work. So I had a conversation with my oncologist, and we decided it was the right thing for me to go back. And I did so initially it was like 3 days a week. And then I started having all these cognitive issues, if I can call them that. So I was having difficulty concentrating. I was exhausted after 2 hours of Zoom meetings with a customer. I was looking for my words and not knowing where to start and kind of not being able to organize. It all came crashing down, I would say, 3 months in. The stress of not performing, of trying to overcome these difficulties and so forth. I had to essentially pull away from work entirely for another 4 months at some point, and I was diagnosed with burnout depression. So it was very discouraging, and that's how I started looking at things a little bit more holistically to plan my second return to work. I took a big step back, and I started to examine my relationship with work. Essentially, do I need to work? Do I want to work? What kind of work should I be doing? It's at that time that I started looking for resources that potentially could help me. So I started interacting with the Leukemia Society, and then through them I found the Cancer and Work site, and I ended up actually reaching out to a career counselor. So even though I've been in my field for 30 years, I said, I want to explore what is it I like about my job. So it was kind of this dialogue between myself, that counselor, using the tools on the site to kind of continuously work through these things. The other element was I reached out to a financial planner because I knew I had to continue working realistically, but could it be part-time, for how long, and so forth. So I tried to understand how much latitude I had, and then finally I had the chance to have the support from a psychologist, and that was very helpful. There's a lot of resources beyond the medical community or to help on these aspects. So life after treatment, going back to work, etc., etc. Those resources, and specifically cancer and work, it gave me a sense that I could take control back of the situation and kind of find the solution with the appropriate resources and tools. There's definitely a lot of help out there, and I found people want to help generally. Like, I found a lot of support. It's a question of helping them help me, essentially, and being proactive in that conversation.
So Fredericks' video and also what Christine has presented in the research underscores the many opportunities for us to better support cancer survivors who have returned to work. So how can we help? So what the research suggests is that survivors report barriers to returning to work is lack of timely medical advice from healthcare professionals on how to prepare to go back. Therefore, healthcare professionals can be more helpful to cancer survivors with return to work or maintaining work by assessing and addressing work-related concerns early on and after work resumption. While there's a dearth of research on vocational rehab, to date, there's very little research. To date, of the research that's out there, the most helpful is being found to be a multidisciplinary approach with a vocational focus. Similarly, cancer survivors who have engaged in work-focused rehab, such as rehab technology, job accommodations, or job accommodation services, vocational training, job readiness, and job search training and job placement services have benefit. As well, employer support, such as providing collegial and emotional support at the workplace, and job accommodations such as flexible hours, changes in expectations, progressive return to work, and the ability to work from home on certain days have been facilitated return to work and job maintenance. Next slide. So again, thinking about the vocational rehab model, healthcare providers can do much to support cancer survivors with return to work. They can provide early and ongoing assessment of cancer survivors' work concerns, even if it's a simple inquiry about concerns at work. So encouraging, for example, a physician, an oncologist, or a doctor who is seeing somebody to consistently and often sort of inquire and add that extra question and inquire about, or do they have any concerns about return to work? They can assist, refer and advocate for referrals to those who can manage cancer treatment, as well as to services such as rehabilitation that can improve function. Healthcare providers can also help survivors access educational resources to assist them to self-manage the return to work process. And certainly appropriate support from healthcare providers can reduce the chances of cancer survivors returning to work too often and too earlier. Next slide. So I'd like to introduce the CancerWork website. This was initially funded by Canadian Partnership Against Cancer, and it was developed by a core team of rehabilitation, nursing, research specialists, psychosocial neuropsychology, and it was augmented by expert writers in oncology, psychiatry, rehab, disability management, insurance union, and legal experts. And it had input from over a 40-person advisory panel of cancer survivors, healthcare providers, and employers. This website both had original content, but also that's unique to Canada, as well as it links to kind of the best sort of articles that are out there available in the globe to support cancer survivors remaining, returning, and finding work. The content is for cancer survivors, healthcare providers, and employers, and it's available in English. So next slide. So I'd like to introduce the steps, 11 steps for iCanWork, and we're going to take this from a healthcare provider focus. Now, we realize for vocational and disability management excellence specialists that are listening in, this may not seem new to you, but again, one of the challenges with the healthcare system, particularly in Canada, there isn't a lot of workforce services that exist in work-focused services that exist in oncology. So kind of the amped in terms of highlighting these steps is to sort of build out the knowledge and expertise of non-VR disability management, sort of trained people to sort of think more about work so they could better support cancer survivors. So a STEP program's not new. It was tried by Nowuchin in Europe, where he'd given a handout to a radiation oncologist to give a handout to their patients to have them give them ideas about how to better to support work, how to better sort of navigate their return to work. The CancerWork website, we developed our own version, and it's featured under the Return to Work, Staying at Work section. And there's 11 complementary steps, 11 for cancer survivors and for healthcare providers, and 9 steps for employers. These steps provide ideas for how each stakeholder can support the return to work of cancer survivors. And these were formed by the research and the vocational practice at BC Cancer Agency. So the initial version of a STEP program was developed by a companion manual that kind of evolved out of the Cancer Agency Return to Work group that we offer and regularly offer. We developed a manual, and we had this manual, we did 2 versions of it, and we had this manual evaluated by 50 stakeholders of patients, healthcare providers, managers and lawyers and union representatives, who found that the content area was both helpful and important. This was rolled in into the CancerWork website and expanded. And then in the last few years, it's been sort of more formally, since 2017, turned into the iCanWork steps. So each iCanWork step for each stakeholder are complementary. They've been tailored to each stakeholder and inform them of the task within each step. The proposed alliance step is to encourage the cancer survivor and healthcare provider and employer to engage collaboratively, enhance stakeholder communication, and ultimately support successful return to work. Of note, these are presented in a step form, but really they're not orderly. Some of them can be happening at the same time. And I would argue step 5, which is communication about work, is if you imagine a tire, the steps are the spokes on the wheel, but the tire is the communication that has to happen throughout the steps. So next step. So since, as I mentioned, it's gone online. So back in 2017, we've developed, updated this version. So the healthcare providers is under the healthcare provider section, and then we thereafter updated the one for cancer survivors, and we still remain with the 9 steps for employers. Next slide. So we're now moving into rolling it into sort of expertise. And last year, we developed a STEP program, the 11-step program for nurses to consider. And for all nurses in oncology, but also nurses that are working, in general nursing, and as well as for advanced practice nurses. So it's available through the Canadian Association of Nurses in Oncology, but we're excited to sort of say that's only really available to members. So we're excited that we're going to have a video version coming probably before March that will be available to everybody to access. Next. As well, we're working on a physician 11-step program. It's an e-course, and it's funded by Canadian Partnership Against Cancer. We have an advisory group of family physicians, and it's actually catered for family physicians and nurse practitioners. It's consisting of an advisory panel of oncologists, psychiatry, occupational therapy, family practitioners, and nurse practitioners. And hopefully we are going to get this out by February, and hopefully sooner. So, and it also includes continuing main pro credits for physicians and nurse practitioners, continuing education credits. So next slide. So now moving into the factors that we talked about. So back to, Christine used the vocational rehab model, and we actually kind of use that as a good sort of way to sort of for healthcare providers, and actually all those involved in return to work, to consider all the facilitators and barriers to return to work. So step 1 is using the vocational model described by Christine. And so taking into account the biopsychological, which is the physical, psychological, cognitive abilities over time, person-related, the person's feelings and concerns about works and their unique social demographic characteristics. System factors such as the supports within or lack of supports within the systems, such as within the financial, healthcare, and family and cultural factors, and workplace factors, which are the supports and the demands of the workplace to explore facilitators and barriers to work that need to be considered or addressed. So let's move to the next slide. So Ken, zeroing in on the understanding the biological factors. So this includes all the biological, psychological, and cognitive factors that precede, emerge, and continue on after diagnosis and treatment. So examples can include pre-existing disability, cancer, disease, treatment-specific factors, late and long-term effects. So assessments should explore how these factors may impact both recovery, work status, and whether physical, psychological, and cognitive disabilities are temporary, long-lasting, permanent, and how are biopsychological factors, how they might impact work. So an example might be the cancer survivor finds the neuropathy in his hands is not improving, and as a result, he is unable to type on a keyboard. Due to pre-existing condition and learning difficulties unrelated to the cancer, a cancer survivor has previously chosen work as a laborer. Now she's unable to do the heavy work required of the job, but does not think she can undertake formal schooling to retrain because of learning challenges. And example 3 is the cancer survivor who previously worked as a manager now experiences ongoing problems with low mood, concentration, word finding, and memory, and feels managing others in a busy work setting would be challenging. So next slide. So then in terms of looking at the person related is factors that the cancer survivors, their perceptions of work, including how they view the meaning of work, how they identify the importance of their work role, their expectations about recovery, and their motivation to work. Person related also includes how survivors view the impact of cancer and treatment on their ability to work, whether they perceive work positively or negatively, such as fears that work stress causes cancer. And this section also, in terms of stress, this section also includes demographic factors such as age, education, and gender influences on return. So for example, the cancer survivor fears stress caused cancer and feels the main source of stress comes from work. Therefore, he's afraid to return to work because he feels this increases his chance of reoccurrence of cancer. And I have to say clinically, and probably one of the big motivators for cancer survivors to come to the return to work that's offered BC Cancer Agency is often their fear that the stress at work has caused their cancer. Example 2 might be cancer survivor wants to continue working during treatment because she feels working allows her to stay connected to colleagues, to prevent her from feeling social and prevents her from feeling social isolated. And actually, in many cases, the cancer survivors want to return to work because they want to be positively distracted by work rather than thinking about cancer reoccurrence. Example 3 would be at older age, working cancer survivors are concerned that the employer will be less keen to have him back because a temporary replacement worker in his job is younger and is paid lower income. So next step. So this is the system-related factor, which includes available financial support, access to wage replacement for how much and for how long, the cancer survivor's economic situation, the availability of resources within the medical system, such as timely access to healthcare for assessments. And I'll have to give one example is, well, actually, I'm going to give example like access to scans and treatments, symptom management and rehabilitation. In addition, factors such as views and advice of the healthcare team can even influence return to work. Other factors include supports from insurance, such as access to vocationally focused rehab programs from the community. And even pressure from insurance companies. For example, case management can also influence return to work. So finally, legal support such as human rights legislation to support returning to work, as well as family and cultural factors can influence demands, pressures, and beliefs regard to work. So here's 3 examples. The breast cancer survivor wants to delay return to work until she's had reconstructive surgery, which is scheduled in 4 months. A cancer survivor has access to funding for exercise program through a long-term disability provider to help her restore her physical ability sooner. Or a cancer survivor worried is that if she takes too long to, time off from treatment, she will not have the legal protection to retain her job. So next slide. So the last one being worksite factors. So the physical, the job demands, the physical, psychological, cognitive, the work hours, full, part-time, evening, day, availability of accommodations, workplace supports by the employer and colleagues, and previous and current relationships with those of the worksite, as well as access to disability management of the worksite. And again, we mentioned about stress. Perceived work stress can fall under the biopsychological, in terms of being anxiety, or it can be considered person-centered about feelings about stress, or it can be, work demands, depending. Depending on the demands of the job, say low demand, high demand, low control. So worksite factors might be, examples of them are the job's very physically demanding and the cancer survivor's lost conditioning and suffers from fatigue. The employer is allowed the person to go back to do by doing lower duties. The cancer survivor is currently able to do work full-time, and the employer is allowed is not able to do full-time, and the employer is allowed graduate to return to work. Where the cancer survivor is concerned, she will not be supported to return to work because some co-workers do not like him. So on to the next step, which is assessing function. So in addition to kind of using the vocational rehab as assessing the barriers and the facilitators, the next is to zero in on assessing function. And just to support this, a Canadian Partnership Against Study argues that having a good understanding of employees' capability and medical condition and side effects is important to return to work. And in fact, a study has shown that assessing function and challenges is part of assessment of workability and has been found to be one of the most important factors in return to work of cancer survivors, independent of age and clinical factors. So identifying cancer survivors' physical, psychological, and cognitive function and challenges to return to work as early as possible with respect to workability is very important in situations to facilitate timely medical and rehab referral to these services, to inform return to work planning, and determine the need for job accommodation if needed, and if needed to give time for job change, because job change takes considerable time. So looking at assessments, a cancer survivor assessments is a great start and is being found to be helpful. And in fact, one study, the cancer survivor assessment of workability at 6 months post-diagnosis was a stronger predictor of shorter return to work time, independent of diagnosis, treatment, working heavy work, and fatigue. Self-assessment of cognitive limitations has been found related to work functioning. So healthcare providers can start by inquiring with the cancer survivor about their work situation, and this can be augmented by formal and informal support, self-report tools. So we have a few tools available in CancerWork, such as the fatigue tracking tool, and then as well as the cognitive symptoms at work checklist, which are specifically sort of designed to sort of identify work-related challenges, so that can be communicated with healthcare providers and insurance providers as well as in some cases employers. These are screening assessment tools. There are other screening assessment tools such as distress scales developed by the Canadian Association of Psychosocial Oncology on their website, which provide guidance on how to assess, but also symptom management. And as well, medical assessments can help. And ongoing medical assessments can help if more treatment and symptom management is needed. And sometimes more formal assessments are needed, like physical and functional capacity evaluations, neuropsychology, occupational therapy, and psychiatric assessments to help the healthcare provider further clarify strengths, work readiness, and interventions and needs for accommodations. And in fact, to kind of prompt the healthcare provider to think about this, because again, not being a specialist in necessarily work-focused rehabilitation, we do have on the CancerWork website sort of some ideas of particularly helpful work-focused assessments, but we also do have a list of sort of the role of various professionals. So we want to trigger healthcare providers to sort of have that VR lens and kind of help for the appropriate referrals. So the next step, next slide, is to understand the job. So not all jobs are similar, and job titles are the same, and even when job titles are the same, the duties can vary. So for an example, in a Canadian Partnership Against Cancer study, they discussed the importance of insurance providers and physicians of having a good understanding of the cancer survivor's job. So this is also echoed by the American Medical Association Guide to Evaluation of Workability. So there's few ways to understand the specific functional challenges that cancer survivors face in returning to job. I think ideally, if available, getting a job analysis from the employer is particularly helpful, or a job description from the employer is particularly helpful for a healthcare provider, because this also gets the healthcare provider to understand the expectations of the employer, and also to really have a clear understanding of the essential and the non-essential duties of the job. Another is to ask the cancer survivor to describe their perception of the job demands when compared to their perceived work abilities, to meet the psychological and the physical demands of the job. And to aid that, the cancer website has created a job analysis, of which Christine, it's soon going to be published in the Journal of Occupational Rehab, the review, but review this website. But again, and similarly, we have a job analysis that an employer can complete. So not, small employers may not routinely do job analyses. So they have an opportunity to kind of use the job analysis that's available online. And I've certainly been asked, when a patient does a job analysis or a self-perception sort of check and they share, it is a perception. And while in some cases, cancer survivors might be anxious about their readiness, but I think the advantage of having these self-assessments is they put kind of the concerns on the table in order to allow us healthcare providers and other sort of stakeholders kind of address those concerns early, so that it doesn't unnecessarily delay the return to work. So on to the next slide. So really, after we've assessed the barriers and facilitators of return to work using step 1, assess the functional challenges with step 2, and compare it with the job demands, the next step is for healthcare providers to refer or advocate for interventions to deal with these challenges. So this could include providing medical treatment, such as symptom management, rehab, which includes psychological treatment if needed, referring cancer survivors to other professionals, such as pain and symptom management specialists, rehabilitation, psychological support, vocational rehab, and social worker. And I think about it in the case of, say, in terms of family cultural issues that was described in the vocational model, or financial sort of support and things like that. There may be a role in terms of social worker in terms of addressing those sort of issues in order to help them overcome their challenges. This step encourages healthcare providers to further aid cancer survivors to return to work by going beyond within the immediate system and to think, what's available out there in terms of rehab, psychological and advocacy support, what's available within community services, the private sector, and other healthcare agencies. And for example, long-term disability, there isn't a lot of in the Canadian system for cancer treatment. There isn't a lot of voc rehab assistance. There's pockets. BC Cancer Agency has a vocational rehab program. They have a Wellspring online program that provides return to work groups, but there's not a lot out there. So again, it means helping and referring to those dots, and or encouraging, for example, long-term disabilities, who often are, if it looks like it's going to promote a successful and foster an early return to work, can be encouraged to provide things like occupational therapy, neuropsychology, and work conditioning programs, especially, and again, if it's not available in the healthcare system. And I just wanted to sort of talk about a few programs where it's kind of very encouraging. An example is I've seen, for example, access to community or insurance funded exercise programs. And while there's little research specific to exercise and cancer, non-work focused cancer studies have shown some value. And for example, one study looked at a high intensity exercise program, which led to reduced time to return to work, increased resumption of work hours, and improved sustained outcome. and as well improve the ability to work, to be able to work, and the quality of life of the cancer survivors. And I think one study really comes to mind by Yates, where they found their high intensity exercise program reduced time to return to work by 2 weeks, which may not seem like a lot, but I think more meaningful is it was 11 weeks to 13 weeks, but they had less reduction in work hours. So 5 for those in the they went down to 5 compared to those in the non-exercise group as 11 hours. And I think even more importantly is more of those who participated in an exercise program returned to work. So 78% versus 66% return to work in the exercise group compared to the non-exercise group. And there are guidelines for cancer survivors. There's consensus statements out there that it's saying that one just most recently done by Kirsten Campbell, a consensus statement that's given some exercise guidelines. And with reference to cognition, practicing tasks such as require concentrations, cognitive skills can improve cancer survivors' self-reported perceived cognitive impairment. And a combination of psychoeducational and cognitive behavioral therapy and distress can improve cognitive, as being found to be helpful. And typically neuropsychology and special focused occupational therapy, which again are not typically available in oncology setting and even the healthcare system, those can be very helpful. And the healthcare system and all of us needs to sort of look beyond and refer out. So as mentioned, reference to psychological challenges, psychological support has been found helpful. And depending on the research, distress for cancer survivors can be 30 to 60%. And there are distress guidelines out there by the Canadian Psychosocial Oncology Network Association. It's on their website as well. They even have some guidelines on sleep management, so survivorship guidelines, and also exercise guidelines. So next step. So again, as I mentioned, this is the tire of the wheel of all the spokes of the wheel. The Canadian Medical Association recommends physicians, their role is to diagnose, treat the injury, and advise and support the patient to communicate appropriate information to the patient and the employer, and to work closely with all those involved in healthcare to facilitate a patient's safe and timely return to most productive employment. Physicians and healthcare providers can play a critical role in the employer's positive evaluation of return to work. So, and in fact, as Christine had mentioned, Amir discusses the lack of medical advice on how to prepare an appropriate time to work as a barrier to return to work. I felt physicians and patients who found that physicians provided tailored advice for graduated return to work were helpful. And Zaman talks about, discusses healthcare providers may need, although additional training on how to do this. And I think this is one of the roles, or one of our sort of focuses in creating the iCanWork program, is that we can sort of bring up the knowledge of general healthcare providers in order to foster return to work. So in terms of communication, often they rely on healthcare team members in planning return to work, and on things like future readiness. So bi-directional communication between healthcare provider and the survivor is important to ensure. So it's helpful for survivors to discuss with the healthcare providers expected recovery and how this recovery is going to look like over time, what they can do to improve their work ability, what resources are available to them, what resources, restrictions and limitations at work, accommodation ideas, and what might be helpful, such as accommodations. And I mentioned in one of the previous presentation was talking about, while it's often up to the employer to sort of provide accommodation, certainly healthcare providers and cancer survivors can discuss and try out sort of accommodation ideas in order to sort of advise employers about what might be helpful. Okay, next slide. So now we're on to encouraging survivors to take control. So research suggests that survivors can play an active role in their return to work, and they have better return to work outcomes. And in fact, the survivorship guidelines that I mentioned, that's on the CAPO, Canadian Association of Psychosocial Oncology website, recommends approaches that include promoting self-management and survivorship and follow-up care, and should focus on enabling and empowering individuals and family by giving them skills and knowledge they need to be active participants in optimizing their own health and well-being. So when encouraging cancer
Hi,
survivors—
Maureen, this is Tammy. So sorry to cross you. Just letting you know you have 5 minutes left.
Oh dear, oh dear. Okay, so we're going to move on quickly. Can you go? So basically, educate themselves what to expect, steps they can take, and how they can manage. So going on to step 7 is again identifying, fostering, and workplace support. So with this, we encourage cancer survivors to, as a recon, basically ask what supports might be available. So having preliminary sort of talks about the jobs, accommodations, and supports that might be available. And encourage cancer survivors also to maintain positive attachments in the workplace. So ideally, these foster the support so when they get back, they get that needed support that'll help them stay at work. So step 8, next slide. So again, working with the healthcare provider, discussing return to work plan. So, you know, again, this involves the healthcare providers from all disciplines sharing their observations and concerns with medical experts, and encouraging cancer survivors to explore job accommodations that might help their return to work and workability. So again, we're sharing their observations. Anyway, next slide. So again, prepare for imminent return to work. So again, with the healthcare is discussing symptom management that are going to bubble up, like sleep, pain, or nutrition issues. And, you know, even encouraging the cancer survivors to do a work simulation, a graduated work simulation ahead of time, and to address things like sleep and things like that ahead of time. So it's not a concern. Next step, slide. So again, help manage expectations. So again, providing advice, such as educational report. And again, this can be augmented by a medical note to the workplace in order to sort of guide a better understanding what to expect, to encourage the survivor to review their workability realistically over time. And next step. And the last one, which is a really important one, and I think our video from Fredericks sort of outlines it, is during return to work process, keep asking about how returns to work, and even after the graduate return to work plan. Because what we're seeing in the research is that there's some people without the lack of support do struggle. And so we need to, and this also includes with managers, and we've developed a return to work plan for managers where they can work with in order to encourage them to have ongoing manager wanting to the cancer survivor to ensure a sustained return to work. Christine.
Hi, so there's only a few minutes left, so I'll just go briefly introduce some of the studies we have, but I think what I want to highlight with everything Maureen has just presented to us is that cancer is not just cancer, it's not just another chronic disease. There are very particularities that individual experience following a cancer diagnosis and because of these treatments that really need to be taken into consideration when you're discussing a return to work plan with them. And so in this study, we have the iCanWork research study that we're looking into providing all the best together, like Maureen just described, using a multidisciplinary approach, especially with a vocational rehab approach that we're wanting to test with 15 cancer survivors who have not yet returned to work, hoping that to provide them, the intervention is providing them with 1 to 3 VR or vocational rehab session and 1 occupational therapy consultation for a work-focused assessment. And then, of course, we'll be monitoring in terms of the primary health outcome, the health-related quality of life, because if you improve all these late effects and long-term effects, their ability to return to work and remain at work will be better. And we'll also, of course, be looking at their workability and return to work rates. Perhaps I want to say, and especially for this study, I'd like to acknowledge and give thanks to the Work Wellness Institute for funding this pilot project, which we hope will help us to position ourselves to be able to submit for a larger RCT once we have our data. And we're still currently recruiting. And so if you know of individuals who could benefit from getting this multidisciplinary VR approach, please send them our way. The information is on the slide. The second study, very quickly, is the usability study of the CancerWork website. And again, here we're looking for individuals to assess the website as it is, but we also have now new features that are going to be added. This is following workshops that we had done across Canada to try to see how can we better improve the experience of individuals when they go on the website and improve their satisfaction. And I won't tell you all what we have new, but eventually they will come. But first we need some assessment and we need to recruit individuals. Maureen has already mentioned, this is our e-course for primary care providers and nurse practitioners. Again, we're looking for volunteers. We have some stipend that we can provide, but we're really looking for primary care providers to come and assess the course before it's released and then after it's released. And also to implement what Maureen just described, that 11-step process with 5 cancer survivors. So if that could be of interest, please, again, contact us. And then finally, this is one of our last study. We're actually, when we produced the website back in 2016, when it was launched, a gap that we've noticed is that there were very few studies, especially in Canada. Now there's been a few that were focused on the self-employed. As you can imagine, being self-employed is a bit different than having an employer where you can actually have some time off, paid leave, and so on. And so we decided to do this study. We've recruited over 20 participants so far. We're hoping to get a few additional, but what we're seeing is that, they actually have to negotiate the type of treatment and when they get the treatment so that it doesn't impede too much on their work or keeping the business open. So there's major issues, and it needs to be recognized and put out there into the policies that they're struggling, and we need to provide their support for the self-employed cancer survivors as well. So this is an additional study that we're doing. And so just to say, this is Maureen and I back in 2016 when we launched the Canadian CancerWork website, which is a bilingual website, which was funded by the Canadian Partnership Against Cancer. And on our right is what you see. We finally just created a CancerWork pamphlet, bilingual again, French and English, that you can download from our website. And it gives you a nice overview of what you can find on the website, which is over 500 pages of resources and multiple online tools and links. So we thank you, and we're looking much forward for all the questions now.
Great. Thank you so much, Maureen and Christine. What an informative and an excellent presentation. And, some of the stats that you were sharing in terms of 1.4 times more likely, people with lived experience being unemployed as a result of their health. Fredericks' video, with his lived experience was just so grounding. So it really centers us on, why this work is so important. So I'm sure participants have questions. A reminder to put your questions in the chat, the Q&A segment of your screens, or the chat segment of your screens. We do have a comment that came in, complimentary, of course. So great to see a course that's covering medical cancer treatment professionals. So kudos again. The first question that I have here from participants is one that I actually jotted down myself, but for a different target audience. So I'm going to join the two questions together. So the question is, are there plans to develop the course or similar courses for other care providers? For example, physiotherapists, occupational therapists, psychologists, and any other healthcare providers. My addition to that is, what about target groups like, for example, unions or colleagues and teammates in a work environment that can either make or break the return to work experience?
We definitely like to, I think about especially colleagues. I think, and again, when we look at the research about how their support is really helpful for a soft landing. supportive workplace. So it's on the wish list. Christine and I, we do this we do this in addition to our various jobs and things like that. So and we do get the occasional, like again, CPAC stepped up and funded initially the development of the Cancer Work website and the iCan course, the course that we're creating for physicians. But we actually did a physio version. But I think what will happen is over a period of time, we'll get these requests and we will tailor make, and we'll add more and more and more to the website so you can zero in. But for now, we have the healthcare providers section, which is a pretty good start in a general sort of guidance for healthcare providers on so anybody can read it, physicians, psychologists, occupational therapists. And actually, I think I have presented on the Canadian Occupational Therapy Association about maybe not this step model, but on return to work and the Cancer Work website before. So we have reached out with them to do specific training.
And just to add, I think when the e-course becomes available, even physiotherapists, they could take the course, and they just have to adjust according to their own specialties. So working in a multidisciplinary team, they would know that their emphasis would be knowing that, let's say exercise, helping a person to feel more fit physically and will help psychologically, will help them to return to work. So what can they do as part of this team? And especially the doctor would then refer to a physiotherapist to increase the person who's feeling deconditioned, how to recondition themselves physically in every way to go back to work. And in terms of the employer, it would be a marvelous if we could do an employer's version, because what we're hearing is, as I said earlier, the employers, they don't know that what are the differences from having somebody who has a cancer. And there's many talks about cancer being a chronic disease. It could be, but there are particularities that people will have with these late and long-term effects that will stay for a long time. So for cognitive challenges, there's about 30% of cancer survivors who will experience these challenges. For some, it tempers off after a while, but for some, it will stay. So having that in mind, then the employer's part, what can they do then to alleviate some of these expectations of the person who can no longer cognitively function and multitask as much as possible, but yet you appreciate this employee. So, what kind of support can the employer provide? But they for those who are not providing it, it's just they're not aware there are distinctions. For them, like many people, the end of treatment is the end of the treatment. The person looks nice, you're back, but that is not the end. It doesn't end with the treatment. So there's much education to be done to the employer. And if we can get funding, if somebody wants to fund us, we can work on an employer version again on the side of our desk, because we're all doing this voluntarily. But it's just to say that at least on the website, there's a section for employer, and that's a start where they could get informed to get educating themselves. And if they have questions, then they can always contact us.
Great. Thank you so much to both of you. Now, if this is what you're doing at the side of your desk, I can just imagine what you'll accomplish if you're fully funded. So
I better acknowledge, I'm not totally doing it. The BC Cancer Agency funds me, but often it's freeing up. I provide patient care. So it is kind of trying to squeeze that in, but the mandate is to sort of provide care for BC Cancer Agency. I think Christine's very much doing it on the side of her desk in terms of, and to speak to the partnership we have, as Christine's is the professor, the research, I'm the clinician. It's been a great little partnership because it's informed clinically research questions, clinically informed research questions, and her expertise and our collaboration has been invaluable. So it's been a joyful project for us to be involved.
That's fantastic.
Me too.
Okay, so we do have a couple more questions.
Okay.
So the next question is, how frequently should employers communicate and check in with cancer survivors to make them feel supported without making them feel under pressure? Excellent question.
So I think that's a discussion they can have. They can start with and say, I want to check in with you on a regular basis so we can, and I think we talked earlier about building trust, and say that I want to support you with this and I'd like to check in with you. What would work for you ideally? certainly in our return to work planner, we talk about, weekly during the return to work, and then maybe, but again, one of the things we say in the return to work planner is not cookie cutter. You have to be very individual. So I think that's part of the trustful communication, to say, I want to check in so we make sure that you feel safe and supported. So I'd like to do this on a regular basis, and particularly provide that for them so that they don't suffer as Frederick did down the road and didn't have their needs addressed.
Great suggestions, Maureen. And don't feel pressured as well. So it's that balance. Yeah. So we have kudos again. So thank you all for an interesting delivery. This person quite agrees with you, Maureen, on the importance of empowering survivors to take control and being active participants in ensuring their health and well-being. So that's definitely a theme we see running through. So another question, are there differences in gender within cancer survivors when it comes to facing more or less challenges or barriers while returning to work? And this is sort of the binary definition that you used. I can't remember, Maureen or Christine, because you specified, men identified and women identified. But I'd also tag on to that, the recognition of gender diverse folks as well, and whether any research has been done on that.
The research on cancer work is very much in its infancy. So it's barely addressed the binary sort of definitions of gender, let alone other sort of definitions and identifications. So it's just, we were presenting kind of what's there so far. Christine, do you want to comment?
But eventually, when we plan to do our full RCT of the iCanWork, we do plan on measuring different gender barriers, if you want, and using like proper measures for even for different LGBTQ to see if they have specific barriers to return to work, or is it gender based on social roles such as having family or children at home, more responsibilities, or looking after the parents. Having or not the support of your family? Are these what are those specific barriers that are associated with gender that actually will favor or not or delay return to work or not returning to work? So we plan on measuring those and when we do the large RCT and looking into that, definitely.
Sure.
That's great to hear.
It's lacking in the research.
Yeah.
Thank you so much for clarifying that. And that's actually really great to hear. So 2 more questions. I think we have 2 minutes, so 1 minute each. Go. From the video you shared, it sounds like there are various resources and stakeholders that are facilitators in helping in the return to work process for cancer survivors. How can we be connectors in this to help further facilitate this process, particularly for employers who want to be connectors without coming across as overstepping or being directive?
Well, first and foremost, we'd like to encourage you to look at the employer section of the Cancer Work website. Not so much employer focused, but there is a community locator on the Canadian Cancer Society where you literally put in what you're looking for, work exercise and things like that. And they'll identify, and you can even narrow it down to region, and they'll pop up. It's a huge resource bank of what's available for their private, public, funded, and things like that. We're, on the wish list for cancer work is that we can build the employer section in order to provide more resources. We certainly have a lot there, but it's on the wish list to kind of expand that.
Yeah, and we have, as the Cancer Work website, we also have a Facebook version, so people can also exchange and seek out strategies that others have used to facilitate the return to work if they want.
Oh, that's fantastic. Thanks so much for sharing that. And the final question, how can employers better identify that a cancer survivor is experiencing challenges after their return to work? What kind of proactive approaches can employers take?
Well, again, it's back to those meetings. Kind of formally, discussing that, let's get together and talk how you're doing. And again, the previous talk about trust and relationship, sort of ongoing, sort of, pre-existing relationships can influence, but sort of setting that that safe place for people to talk. But I do feel formalizing meetings and regular check-ins and saying it from a supportive way that I want to check in to make sure. I think having something like that will do a lot to sort of prevent people from falling through the cracks.
So it's building that culture of communication and accommodation. So thank you so much, Christine. Thank you, Maureen. Excellent presentation. Thank you, participants, for joining us today. And I think that's all, folks, at this point for this session. Thank you so much. Enjoy.
Tammy, great
Thank you.
moderation.
Thank you.
Thank you.